Humans love novelty. Animals do too. But there's something we don't talk about enough in animal care, training, or even in veterinary medicine, and it's called hedonic adaptation. Hedonic adaptation can be defined as the tendency to return to a base level of satisfaction after repeated exposure to the same stimulus. In simpler terms, what once felt amazing eventually becomes normal. And animals, they experience this just as deeply as you and I may do. Think about the first time a dog gets a new toy. Pure joy, full engagement, total obsession. Now check back a week later. The toy is still there, but the excitement isn't. That's hedonic adaptation at work. Animals evolved in environments where novelty meant survival. New smells, new territory, new challenges. Their brains are wired to respond strongly to change, but also to quickly normalize it. This is why zoo animals pace when enrichment never changes, horses sour to routines, parrots feather pluck in static environments, pets with everything still show anxiety or boredom. It's not ingratitude, it's neurobiology. When stimulation stops changing, the brain stops responding. Veterinary medicine exists as a strange intersection of biology, behavior, and emotion. And hedonic adaptation quietly shapes everything we see. A dog terrified on its first vet visit, that fear can adapt for better or worse. If every visit reinforces stress, restraint, and fear, the animal adapts downward. Their baseline becomes anxiety. But if we intentionally vary the experience, short visits, positive reinforcements, novel rewards, or even controlled exposure, we can adapt them upward. The same principle applies to pain management, chronic disease, and even owner perception. A pet owner may panic at the first diagnosis. 6 months later, the condition feels normal. Compliance drops, not because they don't care, but because the emotional spike has flattened. Hedonic adaptation is not the enemy. It's a tool. It allows animals to recover from trauma. It allows chronic patients to function. It allows resilience. But unmanaged, it also allows chronic stress to become invisible, suboptimal welfare to feel fine, and burnout, not only in animals, but also in veterinary professionals, to go unnoticed. One of the hardest things about chronic pain is that it's very good at hiding. Not because it disappears, but because the body learns to live with it. Animals don't scream, they adapt. They don't go to a doctor's office and say, it hurts here. They work with the best they can. We expect pain to look dramatic, limping, crying, obvious distress, because we as humans tend to associate those signs with signs of pain in our own selves. But our own selves are not the same pain signals that other animals may have. Instead, it looks more like sleeping a little more, jumping less, hesitation before stairs, irritability that seems out of character. These aren't personality changes, they're just coping mechanisms. Chronic pain rewires behavior quietly. The nervous system lowers the volume not because the pain is gone, but because it has to keep functioning. That's not healing, that's survival. Here's what hedonic adaptation becomes dangerous. When pain is constant, the brain recalibrates. The animal's baseline shift. What once would have been intolerable becomes normal. Owners say he's just slowing down, she's getting older, that's how he's always been. But the animal isn't aging into comfort, they're adapting into discomfort. And because there's no sudden crisis, the pain becomes invisible. Animals evolve to hide pain. In the wild, pain makes you a target, so stoicism is survival. Domestic animals still carry that instinct. By the time they show pain, it's often severe, long-standing, and deeply ingrained. Especially in cats, prey species, and patients we label as good, quiet, or easy. Silence is not absence, it's strategy. Veterinary medicine isn't just about diagnosing what we can see, it's about recognizing what animals have learned to tolerate. X-rays don't always scream, blood work doesn't always warn, physical exams can look deceptively normal. So we have to listen to the subtle changes in movement, behavioral shifts, owners' observations that feel vague, gut instincts that say something isn't right. Chronic pain patients don't need proof of suffering, they need permission to be believed. Just because an animal is eating doesn't mean that they're hurting. Just because they wag doesn't mean they're comfortable. And just because pain has become familiar doesn't mean it should be accepted. Chronic pain doesn't announce itself, it waits. And the animals who live with it every day are depending on us to notice what they've stopped reacting to.